Lecture 5 in the Practice of Cardiac Sonography 2 unit is called Essentials of Professional Practice Part 2. The contents of the lecture. Firstly, we'll review some elements of professional practice introduced in Practice of Cardiac Sonography 1. Then consider some echocardiogram preparation aspects, matters post-echocardiogram, and finally a conclusion. The learning outcomes. Following this lecture, you'll be able to execute professional practices when preparing to perform an echocardiogram and implement professional practices after completing an echocardiography examination. Firstly, a brief review. In the first Practice of Cardiac Sonography lecture in Semester 1 of the course, some aspects related to professional practice were introduced, and it's worth briefly considering these again. A well-balanced, stable and comfortable imaging position is important in order to ensure you're best able to acquire and measure images, and in order to avoid short and long-term injury. When holding the probe, it's best to aim to support its weight evenly, avoiding holding it too firmly, and it's good to change the grip slightly from time to time in order to minimize fatigue. Where possible, take the time to adjust temperature and lighting settings so that the environment is suitable for imaging and comfortable for patients. Take the time to adjust the chair, couch and machine so that you can maintain a good imaging posture throughout, and so patients are positioned appropriately without undue discomfort. Echocardiographic examinations involve close contact with patients. It's important to treat everyone in a respectful, considerate and polite way. At times, a patient may want to talk during the study. Make sure that any conversation doesn't detract you from a quality study. An ECG should be recorded throughout every examination. It's worth taking the time at the start of each exam to ensure that the ECG trace is optimal. Echocardiogram preparation. Via Views, you can access the echocardiogram examination outline. The aim of this part of the lecture is to expand upon some of the points listed in the section called Preparation for an Echocardiogram. The room and equipment need to be prepared for each patient. And as discussed in the previous lecture for Practice of Cardiac Sonography 2, the indication for each exam should be reviewed prior to commencing imaging. If you are unclear about the indication, it's best to check. This may be as simple as reviewing the patient's notes more carefully, or if there's no information or the information is unclear, making an inquiry to find out. Once the indication for the study is known, some specific plans about how to focus the exam can be made. For example, if the patient has known mitral regurgitation, preparation will involve ensuring that views which show mitral valve anatomy are included. Moreover, continuing with the mitral regurgitation example, Preparation would also involve ensuring to include images and measurements that enable the evaluation of the degree of mitral regurgitation. Before an exam, it's also worthwhile to briefly call to mind your knowledge about the ultrasound machine itself, especially if there are multiple machines with varying applications and capabilities. This may be particularly helpful when arranging a list of patients at the start of the day. Matters post-echocardiogram. The echocardiogram examination outline also includes a reporting section. Along with the report, aspects of which were discussed in the previous Practice of Cardiac Sonography lecture, there are other matters that need attention. Carefully helping a patient to sit, stand, and dress may be required. If the patient is frail or finds mobilizing difficult, it may require that you include the patient's spouse or carer or another staff member. Providing some reassurance about details of the exam may also be required. Of course, full details need to be given by the doctor. As a sonographer, the role is to calmly indicate how the results will be provided. You should wash your hands after every examination. The probe and ECG leads should also be cleaned after each exam. As mentioned at the start of this lecture, the room and equipment need to be prepared for each patient. Most often, the best time to do this is immediately after a study. In the previous lecture, matters related to reporting were discussed. If you deem there is a significant negative change in the patient's images or measurements, or if an important new finding is seen, it's best, where possible, to mention them in person to the cardiologist, making reference to specific images and measurements. Echocardiogram images are, of course, acquired and measured on a machine. The transfer of images to a viewing station should be a routine part of each exam, and images and measurements need to be stored long term. Make sure you support all efforts to securely save examinations, preferably on a system with backup facilities. Ultrasound imaging equipment is an essential part of the imaging service sonographers provide. The equipment is sophisticated, so routine maintenance should be scheduled to ensure that imaging services are as best as they can be. Of course, maintenance should only be performed by engineers with the appropriate expertise. In conclusion, the sonographer's role extends beyond simply acquiring measuring images. It includes implementing important practices before, during, and after each study to ensure a high level of professional practice.